have conducted a lot of health-related research, and National Malaria Control Program is one of our research streamline in terms of malaria research. So in terms of malaria research, we actually help with the National Malaria Control Programs with diagnostics. We are trying to help them trying to find out what methods or what tools that is very best so that we can use to diagnose the parasite so that we can treat. We also help with drug monitoring studies in terms of the drugs that we are using. We test the parasite to find out how they are responding to the drug, also find out the host are responding to treatment. So these are part of the things that we do. And also in terms of the vector, like the transmission in terms of the mosquitoes to us, we also have a research stream that we also monitor the vector population in terms of the sprays that we are using, whether they are working, and also inform policy on how to target them or the interventions that they have to use in terms of malaria control. So these are some of the things that we do to support the National Malaria Control Program.
Okay, Dr. Amoah, we know your institute has a huge malaria research portfolio. Can you tell us the various research areas?
Okay, so the Noguchi Memorial Institute for Medical Research has a very wide portfolio with respect to malaria research. I can talk about some because I could spend the whole day talking about it. We do research on diagnostics. If we are unable to detect people who have the parasite, we can provide treatment. So we have a very big portfolio trying to find new diagnostic tools that should be used and whether these tools remain effective or not. We also have another group that is looking into vaccines. So today we will talk a little bit about the malaria vaccine that we have, but then there is a lot of malaria research at the institute. The malaria parasite has several life stages, and each of them needs to be targeted to ensure that we would end up with zero malaria. So we have different groups who look at the different forms of malaria parasites. You have those who are looking at the particular malaria parasite that is responsible for pregnancy-associated malaria. There's a group that is looking at a vaccine that would be effective against that particular parasite strain. We have some that are interested in looking out for identifying vaccine candidates for the malaria parasite that is transmitted from a person to another person. Then we also have another group that is interested in looking at the malaria parasite stage that causes the disease itself. How best can we get a vaccine to clear those stages? So there's a whole lot going on. We have another group that looks into vectors. So they're looking at vector resistance to insecticides. They're looking at spraying breeding grounds with larvicidal agents and looking at all the various agents or tools that come in country that need to be evaluated for their effectiveness against the malaria parasite or the mosquito. We have different groups that do that. So there's a whole lot, and I think one day we'd actually come and just talk about. But today we're here to talk mainly about Malaria Day, that is tomorrow.
So there are now calls for data-led strategies and increased investment in the research and development of transformative tools. In terms of funding, do you have enough to achieve those goals?
So there is definitely not enough funding. I mean, sometimes we spend proposals to get grants. There's very little funding available. At the institute, we are primarily funded by external donors. By that means that we apply for grants or we write proposals. Some of them are funded. We do have the NMCP also supporting some research that we do at the institute, but then primarily it is sought by winning grants, and we definitely don't have enough. Else there'll be so much that we can do that we are not able to do because we don't have enough funding to do that.
Thank you. So back to you, Dr. Ruth Togbe. What are your thoughts on the first malaria vaccine and the gains made so far?
Okay, so Ghana was very fortunate to be part of the 3 countries that they actually pilot these vaccines for the past 3 years, Ghana, Kenya, Malawi. And then the rollout is very successful so far. We are among the countries that we are receiving this privilege because actually in terms of buying vaccines, in terms of rollout, and then in terms of accessibility. So the WHO, as part of its mandate, and also as Ghana Health Service and then the National Malaria Control Program's mandate, now children under 5 years is part of our regular vaccination program for them to receive vaccines. And for us, it's a very big breakthrough for us, because in terms of, if you look at the malaria cycle, it's a very huge cycle. That's why we talk about the vector, we talk about the human being. So if you want to eradicate malaria as we are seeing now, or to other diseases that we have seen previously, then the vaccine is something that we really have to go for it. And then it's part of the ones in progress. It's not 100% now, but they realize that it has really reduced in terms of child mortality recently, because now we don't see a lot of children being dying after the rollout. So it's something that we really have to go for, like the regular vaccination that when we were kids that they were given to us. So the times of the vaccines, fortunately Ghana, that was one of the pilot projects where we have it. So I entreat every parent and who have a child under 5 to really go for the vaccine, so that to protect all of us from malaria in terms of the economics and then in terms of our health.
We are indeed fortunate. Now, Dr. Amoah, the deadline for attainment of malaria goals of 2030 is just 8 years away. And which key malaria prevention and control interventions are yielding results in Ghana?
Okay, so with this, it's mainly efforts that the NMCP are working on, and they have their objectives and their strategic plan for 2021 to 2025, and it's the hope that by 2025, so for right now, the strategic plan is up to 2025, and they're hoping that, or we are hoping, the whole malaria community is hoping that we would have at least a 90% reduction in mortality and reduction in incidents compared to 2019 rather, and that we have now 6 districts, one in the Ashanti region, that's Asukwa. We have Ayawaso West, Tema West, Ablekuma Central, Shai of Sudoku in the Greater Accra region, and Hohoi in the Volta region, that have actually been earmarked to go into pre-elimination. This is a very big deal, because for right now, most of the country, we are at the control phase, which means that we are controlling, preventing disease. But when you go into pre-elimination, it means that we are actually trying to reduce malaria to 0 in those communities, which means that we are implementing additional control interventions, because for now, malaria transmission in these particular settings are low, and so it's going to be adding a few more additional innovative interventions will reduce it to an extent where, I mean, it's almost existence. That's what we mean by pre-elimination. So we're really happy that there are some places where malaria isn't that high, and we actually are seeing pre-elimination. I think that's a really good thing. And then we are doing constant sensitizations and DEBAs, and it's all about that. With malaria, it's preventable, it's treatable. So once we increase our awareness, once we increase the awareness of the public, we do enhance education, then I think we would be able to reach our targets.
Okay, so how do we step up the fight against malaria by not self-medicating and ensuring that patients, complete their full course?
I think, as we said, it's part of one of the key things that we need now is to letting people understand why they have to take the medication, when they have to take the medication, and how to take the medication. I think just like have issues with people just self-medication in terms of when they are not testing, because previously we have this perception that once you feel feverish, once you feel cold, or when you're at home, it's malaria. So we end up always taking chloroquine when chloroquine was in use. So people still have that perception, and then generations are still going on taking anti-malaria drugs that they are not supposed to. So one of the key things that we have to do is, if you think that you are feverish symptoms, you have to go to the pharmacy shop or the nearest drug outlet or the hospital. They have simple testing kits that the RDTs, they will test you, and then you can get your ACT. So one of the key things that is the education have to go out there. You don't just take the medication, and we have to take the medication religiously as instructed. The first don't say the next 8 hours, morning, evening, then we are done. You don't have to stop taking the medicine when you feel you are fine. You make sure that you complete the dose, so that together we can all drive malaria.
So Tomorrow is World Malaria Day. What should we expect? What is your focus area?
Oh, okay. So we actually started our sensitization activities last week. We've had a lot of outreach activities. On Friday, Noguchi was at Ejumakun. We had a community deba. We educated a whole community. We tested and treated. Tomorrow, the malaria control program and some of its partners will be in Hohoi. Will be in I think it's Hohoi. Kind of them will be in the Volta region, and to be in Hohoi. Hohoi is the place that is earmarked for pre-elimination. They'll be there to also do test screen, do a lot of education. For right now, I think we're all interested, and we all realize that enhancing education would be one of the features that we need, because once people are educated and know what the symptoms are, how do they get malaria, how can you prevent yourself from getting malaria, the fact that you need to be tested and you need to have a positive test before you actually begin your treatment, the fact that if you don't complete your treatment you have a lot of negative things happening. I think, yeah, so that's what we're doing. And on the 28th there's going to be a symposium at Noguchi, and then yes, so there are quite a number of activities lined up, and most of them are to create awareness about malaria control and prevention, and the fact that in Ghana we are moving close to pre-elimination. That's great.
Any other thing you would want the public to know?
As we had already said, zero malaria starts with you, me, everybody. So we all have our collective responsibility to play in terms of eradicate malaria. So in our small way, we have to educate people not to leave water in pans. We have to educate people on how to keep their surroundings clean. We have to educate people on the medication, especially if you have the course, you have to finish all the course so that we don't have the drug resistance being on. And then for people that they have children under 5 years, they should please go to the health facilities and then take their vaccines, which will help all of us live together and have a healthy life. So I think that's all for now.
Zero malaria begins with all of us. Thank you.
Thank you.